Welcome, students, to today's lecture on nephrology. We will be discussing a case that will help us understand the mechanisms behind acute kidney injury in patients with heart failure. Let's examine the details of the case. We have a 63-year-old man with a history of heart failure who presents to the emergency department with decreased urine output and fatigue. To investigate the cause of his symptoms, his doctor orders a urine test. The results show a urine sodium concentration of 5 mol/L and a fractional excretion of sodium of 0.5%. Our task is to determine the most likely cause of the patient's acute kidney injury. The options: we have several potential causes to consider. A. Prerenal AKI. Intrarenal AKI. Postrenal AKI. None of the above. Analyzing the results. To interpret these results, we need to understand what the urine sodium concentration and the FeNO tell us about the patient's kidney function. Urine sodium concentration. A low urine sodium concentration typically indicates that the kidneys are responding to a state of effective volume depletion by avidly reabsorbing sodium. This is often seen in conditions where there is a reduced cardiac output, as in heart failure. Fractional excretion of sodium. FeNO is the percentage of the sodium filtered by the kidneys which is excreted in the urine. A FeNO of less than 1% suggests that the kidneys are reabsorbing sodium efficiently, which is a hallmark of prerenal causes of AKI. Making acute kidney injury, it is essential to consider prerenal AKI as a likely diagnosis, especially when the urine sodium concentration is low and the FeNO is less than 1%. Understanding these laboratory values in the context of the patient's clinical presentation allows us to make a more accurate diagnosis and manage the patient appropriately. Remember, the kidneys and the heart are closely linked, and dysfunction in one can often lead to complications in the other.